Hi everyone, welcome to the Right Way Wednesday. Today, this is Rebecca Rambo, and I'm here to talk about another OASIS M item. That is OASIS M1840, toilet transfers. So I know on my previous discussion about just transfers, we talked a lot about the different things that are required, making sure that we start it from the beginning. So another item that can trip up clinicians is the toileting transfers. And this item, one of the most common things would be not assessing it properly, assuming that their transfer score is the same as their toilet transfer score. I'm an OT by nature. I know that transferring from the bed to the closest chair, that can be a completely different ball game than going into someone's home and seeing their bathroom. Everyone's bathroom toilet setup is different. So assuming that just because they can transfer from one surface to another and seeing that translates to the bathroom doesn't matter. It could be a completely different score, a completely different environment. So it's really important to actually assess these items as much as you can. Now, you can take certain things from report on the OASIS and use your clinical judgment, but when you're able to, actually have the patient go in there and do the transfer, do the toilet transfer, do that as part of your assessment. That's really the best practice. For toilet transfer, the score on the OASIS, it's a 0 to 4. 4 being that a patient is totally dependent on toileting transfers, and 0 being that they're able to get to and from the toilet and transfer independently without a device. So that includes being able to get to the toilet. So think about, is there any barriers in the way between where the toilet is located in the home? Those need to be considered into your score. And a 0 would be with or without a device. So a person might score a 0 even if they use an assistive device, if they can do all of those components independently or independently with a device. Something else to keep in mind when looking at the toilet transfer, this does not include toilet hygiene or any of the dressing components. Those are scored in other areas of the OASIS. This is truly just looking at being able to get up and down off the toilet, getting to and from the toilet safely and independently. So you've got your, we talked about 0, we talked about 4. In between, a score of number 1 means that when reminded, assisted, or supervised by another person, they are able to get to and from the toilet. So that could be verbal reminders, that could be some sort of assistance in that way. A number 2 would be they're unable to get to and from the toilet, but they're able to use a bedside commode. So maybe they have a barrier in their home, a very narrow hallway, or a doorway that doesn't allow their walker to get through, or their assisted device. If they're able to use a bedside commode, you independently, with or without a device, they would be scored at a level 2. And then similarly, if they are unable to use a toilet or a bedside commode, but they can use a bedpan independently, that with or without an assistive device, they're allowed to use like a trapeze or a bar. If they can use the bedpan independently in bed, that person would be scored at a level 3. If they're unable to do any of those at all, then they would be considered totally dependent in toileting, which would be a level 4 on the OASIS score. So thanks for tuning in as we go through and kind of talk about some of the most common OASIS questions that we get and some OASIS scoring items. Thanks, everyone.